So good afternoon. I'm Katie Boyle with the Virginia Association of Counties. And on behalf of my colleague, Chris McDonald with VACO, who handles public safety issues for us, and our colleague, Janet Arison at VML, we want to welcome everyone to this briefing on implementation of the Marcus Alert legislation that passed during the special session. So as you all know, this is a complicated bill that seeks to ensure that individuals experiencing a behavioral health crisis are diverted to the behavioral health system when possible, and that they receive a specialized response from law enforcement when necessary. The bill has pretty ambitious deadlines for implementation, and it will involve the public safety, E911, and behavioral health systems. So it was very important to us to keep our members informed as implementation moves forward. And so we really want to thank the staff at the Department of Behavioral Health and Developmental Services and the Department of Criminal Justice Services for being with us today to provide an update on the legislation and the process by which they will be developing a plan for implementation. So from DBHDS, we are very pleased to be joined by Mayor Signer, who's the Chief Deputy Commissioner for Community Services, Dr. Lisa J. Shields, the Deputy Director for Community Services, and Heather Norton, who's Assistant Commissioner for Developmental Services. And from DCJS, we'd like to welcome Harvey Powers, the Division Director of the Law Enforcement Services Division. So just a couple of quick housekeeping measures. We are trying to kind of keep everybody on mute because we have such a large turnout. I see we already have almost 120 people, which is wonderful. So if you could just be mindful of staying on mute if you're not speaking, that'll help us with the background noise. If you do have a question, there is a chat box feature. And if you type that question into the chat box, I'll defer to our presenters as to whether they'll take questions at the end of the presentation or field questions as they go. I think that's probably the easiest way to do questions. We are recording this session and we'll make it available afterwards so that you can share it with your colleagues who aren't able to be here in person. And so with that, I think Dr. Job Shields will start the briefing. And so I'm going to switch over to your slides, Lisa. Lisa, I'll turn it over to you.
All right, thank you so much. And so I'm going to be providing a lot of the slides today. I'm actually going to ask Mira to kick us off at the very beginning. And so that Harvey, myself, Heather, and Mira are on the line. I'm actually going to do some introductory remarks.
Thank you so much, Katie. Can everybody hear me? I don't know, maybe a couple of nods. Okay, great. Thank you so much. Again, my name is Mira Signer. I'm from DBHDS, and just really wanted to thank VML, VACO, DCJS for your partnership. See, there are plenty of participants in the meeting today, and we're really glad to be able to do this informational call. I know we only have an hour. In terms of the questions, Katie, we're thinking of trying to save those to the end, if at all possible. So we're going to try to monitor our time as best as possible and hoping to really try to carve out 15, 20 minutes at the end, if that works okay. And if we need to veer from that, we'll do the best that we can. So again, I guess next slide. Am I able to control that? Yeah, okay. So just really briefly, in terms of what we are planning on covering on the call today, we wanted to cover, obviously, a brief overview of the legislation. As mentioned previously, this was a legislative initiative that was introduced during the special session this summer. It was signed into law in November, and it is known as the Marcus Alert Act. That is actually written into the legislation. We will cover readiness assessment for localities, which basically includes considerations for the areas that are interested in being part of the initial implementation area, which we will also cover during the presentation. We will touch on some of the deliverables for year one, as was mentioned previously. This is a very ambitious act with many pieces and several key deliverables for the first year as written into the act. So we will touch on those as well. And then also time for questions and answers. Next slide, please. So just briefly, probably a lot of people are already aware, just due to the coverage and the visibility of this act. And, you know, Katie, your words were really perfect in terms of what the Marcus Alert is. So just really broadly, it is a reform process that seeks to put in place a system to coordinate and improve the crisis response at the local, regional, and state levels to divert people who are in mental health or behavioral health crisis to the mental health system. It was named, and we'll get into a little bit more specifically in terms of the protocols, procedures, and response teams that are delineated more specifically in the legislation. It was named for Marcus David Peters, and this bill and the legislation was largely the result of an advocacy effort that was led by the family and advocates of Marcus David Peters, who was a young man in 2018, who was fatally shot and killed in 2018 in the midst of a this. And again, the legislation is known as the Marcus Alert Act. And I did see a quick question in the chat about will the slides be distributed, and we're more than happy to make those available. So just next slide, please. Very importantly, we think that the legislation, the Marcus Alert Act, details both shared responsibility and specific agency purview areas. To touch on those briefly, so DBHDS maintains purview over the development of the mobile crisis response and comprehensive crisis system more generally. DCJS maintains purview over monitoring law enforcement progress towards the goals stated in the Act. DCJS is the lead on the voluntary database requirement, which is also mentioned in the Act. DBHDS is the lead on the voluntary database component. I'm sorry, the public service component campaign, as well as there are numerous collaborative aspects, notably that DBHDS and DCJS will collaborate regarding the protocols for all aspects of the Marcus Alert, including the protocol for law enforcement backup of a mobile crisis response when necessary. And again, we will go into the specifics of that further in the presentation. Next slide, please. Okay. Heather?
Yes, thank you. This is Heather Norton, Assistant Commissioner with the Department of Behavioral Health and Developmental Services. And what we also wanted to do today was to provide information around the comprehensive crisis system that is being built simultaneously as we're implementing the Marcus Alert system, and specifically show where those two major initiatives overlap with one another. And so the work that we're doing is based on the sequential intercept model, with intercept 0 being community services, a crisis line that acts as air traffic control, a crisis care continuum, including mobile crisis, 23-hour observations, crisis stabilization units, and then of course intercept 1, which is that encounter with law enforcement. And you'll see by the bidirectional arrows where we believe that the Marcus Alert and the comprehensive crisis system overlap. When law enforcement is first contacted, and individuals can appropriately be re-referred back to the crisis care continuum, or when calls are received at 911, that might be better managed through the crisis call center. And so we are looking at these two major initiatives and looking at the opportunities where we can partner together to ensure the right response for individuals who are in a mental health crisis. Next slide. The work that the Department of Behavioral Health and Developmental Services has been doing has been based on national best practice models, specifically the Crisis Now model, that has 4 major components. The first being a high-tech crisis call center that really acts as air traffic control for all crisis calls that come into the system, a 24/7 mobile response or mobile crisis response that meets people in the communities where they're at, and crisis receiving centers, which are a combination of drop-off, 23-hour observation, as well as crisis stabilization beds. And then finally, where that intersects, what we're doing here is those essential principles and practices that include a focus on recovery, trauma-informed care, and a commitment to zero suicide or suicide-safer care. And essentially strong commitments to safety for the individuals and staff, where we are in collaboration with law enforcement. Next slide. Lisa, did you want to pick up here?
Yeah, and we can, the next 2, we can kind of tag team a little bit if that makes sense. So I wanted to share a little bit about our general approach to the work. So like Heather was discussing, you know, what's really rooted in this idea of an ongoing crisis system transformation, and really pulling together all of these best practice elements, and really looking specifically at those cooperative relationships with law enforcement, which are, you know, one of about 4 essential elements that the model recognizes. We also have to focus on supporting the rights of all Virginians, of where you are in Virginia, regardless of race and ethnicity, to access the behavioral health system safely, and have that access in a timely manner and in the least restrictive environment. Thank you. We think that by approaching this with the idea of decreasing Virginia's reliance on law enforcement as the de facto response, that overall the system will improve, and that this is a goal that everyone across agencies is enthusiastic about, and thinks is a good fit for where our system needs to go. And ensuring that folks with disabilities, they get the accommodations that they need, that they get a safe, a compassionate, a trauma-informed response when law enforcement is involved in the behavioral health crisis, whether they're a first responder by themselves, whether they're part of a co-response team, whether they're serving as backup to a mobile crisis team, that's a reasonable expectation for Virginians with disabilities. Next slide.
So I will.
Yeah, let me take it back to that one.
So what we wanted to show here in this slide is the intersection, if you will, of the comprehensive crisis system and the Marcus alert across various levels. So from a state, regional, and local perspective. Additionally, you know, there is the federal implications of the launching of the 988. And so ultimately, all of this looks at where we can address individual support needs, whether at a state, regional, or local level, and then the different parts of each of the systems that fall into each of these areas. So specifically, as has been mentioned in terms of the air traffic control or the crisis call center, and then of course the standardized measures. From a regional perspective, our mobile crisis hubs and the crisis stabilization units, our crisis assessment centers, which function both at a regional and local level, and then mobile crisis teams that are regionally but are co-located locally when appropriate. And then, of course, the local response in terms of crisis services is specific to emergency services and community-based crisis stabilization supports. And for the Marcus alert, in terms of the state perspective, in terms of protections for individuals and standardized measurements, the regional is the agreements between the mobile crisis hub and the PSAPs, as well as local law enforcement for backup. And then, of course, the local is the local protocols for a no force first approach, warm handoff procedures, and local co-response teams when sustainable.
Next slide. All right, this is getting a little bit into a very general high-level timeline. If you've read the bill, you see there's lots of complexities there, lots of different pieces. But particularly looking at some of the first pieces of the timeline, these are things that I wanted to highlight. First, in about 6 months, July 1st, 2021, a plan needs to be written as a written plan with diverse stakeholder input, and it's due to the General Assembly. What it includes is sort of a catalog of all the existing programs that are related to this, whether they're mobile crisis, CIT, additional programs, crisis stabilization units. So sort of a report that sort of catalogs all that and its funding as well. And then the requirements for this protocol development. We'll talk about sort of 3 different protocol pieces. And essentially in our plan, we're going to have to provide those details of which protocols exist at a state level, which are more of a minimum practice or a best practice, how we will review and approve those protocols. So all of that is needs to be pulled together with stakeholder input by July 1st. December 1st, 2021, 5 initial areas need to be covered by all of the components of the Marcus Alert. We'll be talking about it as sort of these three components is sort of the easiest way to think about it. And so these first 5 areas need to have the whole program at least initiated by December 2021. By July 1st, 2022, so about 18 months from now, all localities need to be covered by the protocols, and at least 5 more areas need to be covered by all of the components, which essentially means that in addition to being covered by protocols, also have these active teams that are responding in the community. And then essentially the additional response teams are built out over the following years until statewide coverage is achieved for all units. Next slide. And so this is a little more, really zooming in on what is the specific definition of the Marcus Alert. One thing that very early on in the process was clarified a number of times is, the parallel to the Amber Alert, and it's not an alert in as much as it's, something that would flash across the screen in that way. It's really at its core is sort of this series of protocols with the aim of diverting to the behavioral health system and provide these specialized responses. We really see it as being in these 3 areas. The first is the protocol to divert from 911 to the crisis call center. So could be called a full diversion, essentially coming up with that state guidance of what types of calls and with what types of supports can we have a diversion to this crisis call center being built through Step Virginia, DOJ settlement, and as well as behavioral health enhancements, which is the accompanying Medicaid rates for these services that will be coming online in about a year as well. The next part is MOUs for law enforcement when serving as backup. So again, this is sort of how the Crisis Now model might approach it, this idea of you need to have close coordination with law enforcement. So essentially, what type of standards do we need to set at the state level for when the mobile crisis team seeks law enforcement backup for safety supports during a response? And then third, some sort of statewide framework I believe it says that we need to include both minimum standards and best practices for essentially types of law enforcement specialized responses for situations where maybe law enforcement is already involved. It wasn't clear that it was a behavioral health emergency, or law enforcement becomes involved, and it doesn't go through any type of dispatch central framework or anything like that. Essentially, sort of how can we, what types of framework would be helpful at the state level to then put that specialized response into play at the local level. So that's kind of the third piece. You can go ahead. All right. And so the local readiness to be an initial area is something that we came up with, essentially a checklist of things to be thinking about as a local area, particularly when you're trying to decide if you're interested in being one of these initial areas. The idea being that the state group and the initial areas are going to have to be working really closely together due to the timeline. The state plan will be written July 1st, whereas the initial areas need to be initiated by December 1st. So the idea is that areas that already meet these readiness factors, it might be more straightforward to kind of jump into the process and have some of this ground covered, so that we can meet that aggressive timeline. So the first one is buy-in across sectors. You can tell by reading the legislation, there's so many different areas that are covered in this legislation. So the idea that across these different areas in the locality, there's buy-in. It's not just one agency that's interested in participating. Also that across agencies, there's been this acknowledge of the role of racism in this, not only in some of the calls for reform in policing that happened this summer, but also disparities in the behavioral health system. And that's something that leadership acknowledges and has some sort of general understanding of. Similarly, that community members were calling for this reform. Doesn't have to be specifically this reform, but something in those demonstrations this summer that the community was coming together and showing interest in changes like this. Just a willingness to really look at your current laws and regulations. We have some state frameworks here, but a lot of these parameters we're talking about exist at the local level. So the idea of, putting them on the table and looking at them from this perspective and sort of thinking that is worth the time and effort. And then looking at the policies and data and financial information across agencies as well. Again, since we're talking about these responsibilities that exist across agencies, that idea that the locality would be comfortable bringing these people together and talking across responsibilities. Next slide. Relatedly, this idea of someone on the team from the local government that is looking across behavioral health and law enforcement, that it's not just those two agencies coming together, that there's someone that's taking a view more broad than that. Buy into the regional of the Step Virginia crisis system. This is really important because as Heather and Mira were describing, we're still building this system. We just recently got funded for this crisis call center and the staffing that's going to take. And there's a lot of moving parts building these mobile crisis hubs at the regional level. And so we really need the first 5 areas to understand that and have a lot of buy-in when it comes to this crisis now model and the role of the regional hubs. One phrase that you'll hear out there is this idea of a safety net to the safety net. We want the 5 initial areas. I'm going to bring Harvey in on this one. We want the 5 initial areas to be willing to look at their use of force protocols and other details of police presentation. Because of the timeline and not knowing where exactly the plan is going to land in July, we want the first 5 areas to see use of force as part of this and be willing to engage with us in that conversation, because the behavioral health response being a no force first response, we're looking for areas that are willing to go into those conversations with us. Harvey, let me pass it to you if you want to add anything there.
I appreciate it. Thank you. Just a couple of quick things. DCJS and DBHDS, we've already had a significant level of communication in preparing for these steps for the Marcus alert. There's a state panel that'll be coming online that we'll talk about in a minute that'll help us navigate this. And the key part of this is to recognize that DCJS by code still maintains purview over use of force and body-worn camera policies and procedures. We are simply seeking agencies that are willing to re-examine this to see in what areas they can make improvements and prepare themselves for integrating with more of a behavioral health response in this aspect. That was something that I've raised a couple of times in conversations, and DBHDS has been very responsive to it. I don't believe there's any indication that they are looking to take that one by the lead themselves. We're going to certainly do this as a collaborative effort. So I think that's important. And many in law enforcement that have shared with me some concerns have focused on that aspect of it. So Lisa, I'll pass it back to you on that.
Thanks, Harvey. And so then we have also looking for areas that see the importance of working as a region, again, because whereas a lot of the pieces of the Marcus Alert are going to be at the local level, because the Crisis Now model emphasizes the statewide and regional infrastructure, we're looking for initial areas that, sort of see that complexity, that see that they're in a system like this, there are going to be things that exist at each level and can kind of see how the importance of being the initial area, we need to be thinking about how that's going to fit together. We want the right supports at the right level for each of these. So we want initial areas that that can see some of that, that our regional partners maybe even know a little bit about some of the big differences between their area and some of the other areas in their region. Next slide. All right, so this is thinking about it from the perspective of an initial area. So we kind of have looking at it as an initial area, and then next if you're a non-initial area, because either way the timeline's pretty quick all the way around. But for the 5 initial areas, it would look like forming your area group by about March. You would need to send a representative from your group to the statewide group. Now, we hope that, we're trying to get a great level of representation across the state on that group already, but there will essentially be another layer of, for those initial areas, they'll actually sort of send someone from their local or regional group. They'll send that person to all those meetings just to keep the lines of communication open. You'll need to be working with your region about the mobile crisis hub. So, some regions, the mobile crisis hub and the initial area might be the same location. Others, it's going to be different. So you'll need to be having those conversations. Again, the funding for Step Virginia Children's Mobile Crisis went out during this past fiscal year, but the adult mobile crisis funding is something that's just on the horizon, not even here yet. So we're on these kind of parallel timelines. We're going to be providing some kind of work plan, almost like I don't want to call it a workbook, that's not the right word, but we're going to kind of give some guidance in terms of different things that you'll want to work through and plan through during the process. You'll need to get together a budget and a plan. We're thinking something about August would make sense for that realm to do some of the preliminary planning and then have a budget. And then be ready to stand up December 2021. And I'll mention again that at that point, the mobile crisis call center should be online. We're on very parallel timelines. And then also the behavioral health enhancements, the Medicaid rates should be beginning either December 2021 or January 2022. So for when Medicaid members use these services, there will be a corresponding reimbursement rate. Next slide. All right, so thinking about it from the other perspective, if you don't see yourself as an initial area or have already talked to folks in your region and sort of know where things are headed, first you would want to take steps towards readiness. If there are things on that checklist that really jumped out at you as, this really isn't how we look at things, we're happy to help talk through some of that and work with you there, or make recommendations of things that you could do to, come together in those areas. Make sure that you seek representation on the state group and also stay involved. We'll talk a little bit about kind of the open meetings and calling for comments. Carol, I see the PSAPs. I know I got to stop using that acronym. I had learned that from outside of my area. That's the public safety answering point. So it's like the 911 emergency communications. I'm learning that that's not the term that folks use for them. So I got to replace that, but that's what the PSAP stands for. So essentially kind of all that to say, even if you're not in an initial area, stay involved in this initial implementation because, we're framing up the plan at this time. You'll want to start forming your local group, essentially probably after we release the state requirements, so something like July. These are kind of So remember, the first two parts that the non-initial areas have to have are the two protocols, one that is diversion from 911, and then one that is when serving for backup. So those would kind of be coming online first, and then that specialized response, there'd be a little more time there. But during that first year, you might go on and do some planning for your team coverage. One of the big things here is there's these different models of responses that can work. The first being mobile crisis, which is what we're building through STEP Virginia, in which case you would be focusing on having that mobile crisis coverage and doing a lot of just kind of warm handoffs and working on your assessment drop off and things like that. Versus other areas, particularly maybe urban areas or high population density, really building out these community care teams specifically, or co-responder models and things like that. So you might be able to do some of that planning in terms of sort of the big picture vision, before the state frameworks come out. And then you'll be thinking about submitting a plan for approval to implement July 1st, 2022. And again, that's to implement those first two protocols, not to actually have that specialized response fully responding. As you know, the STEP Virginia teams will start responding during that time as a region. So, we're going to be building it at the same time and figuring out kind of what supports need to be at which area. You can go ahead. All right, so this is the state stakeholder group. So nominations just closed last week. We got over 300 nominations across 8 different areas of stakeholder engagement. Essentially, we are looking to we want this to be a working group. About 20 people is the goal. That does not count the DBHDS and the DCJS representatives. But as far as the stakeholders that we're pulling together, we really want this to be a group that can work together, because we will have additional time for public comment and things like that. So we really want the group to be a size that can really get work done together for this initial plan because of the timeline. DBHDS has been approved for a staff position, and so has DCJS. So those will be 2 folks that will come online and will be very involved in it. Myself will stay involved, Mira and Heather, Harvey at DCJS. We also have Stephen Craver and Alexandra Harris, and I think that they're both on the line, who will be, so Stephen is our CIT coordinator and Alex is our a policy director. So we'll have some other folks on the team as well. And this is just sort of an example breakdown of what it might look like. This is not set in stone, but as we look across all the different stakeholders we need to involve, this is an example of how it would break down with mental health, law enforcement, social justice, racial equity, emergency communication, and things like that. And essentially, what we're trying to do is we're trying to kind of get the different areas covered. And then there's this other layer of making sure that we have all of the regions covered, and that we have a diverse group and things like that. So we're working together to try to make that, to get that group composition right and representative. Next slide. And so these will be open meetings. So essentially, each meeting we will have an opportunity for public comment. It'll be towards the end of the meeting, a smaller amount of time, maybe something like 10 minutes. But then we're going to have 3 broader meetings that essentially are focused on more of a public comment framework. So thinking by about March, we should have some, whether they're details or more like questions, things that we're struggling with. We'll be able to bring those to a more public call and get more broad stakeholder feedback. Those will be in addition to the set stakeholder group meetings. So we're thinking about 3 of those. Probably we'd have something to present and get reaction to maybe around March, maybe then again in May, and then with the last one being almost more of a, we might sort of have most of the plan of what we're going to be putting forward in July together, and it would be kind of getting final input there. So that's kind of how we're thinking of structuring the broader engagement. Next slide. All right, and so this is just to wrap up, and so then and next we can move on to Q&A. If you want to learn more about the Crisis Now model, that is a link to their website. They've got some great videos and some great resources. And you know, where we see this going is we see a coordinated response at the state, regional, and local level, and between Intercept 0 and Intercept 1. You know, this is an opportunity for us to get it right across both of those intercepts. And although there's challenges associated with kind of building both out further at the same time, you know, it's actually a very unique opportunity, which when you couple that with the 988 federal legislation that requires us to have a 988 as a national suicide prevention lifeline number by July 16th, 2022, you know, this really is an opportunity for us to get it right. We think that this will lead to increased diversion to the behavioral health system. We think this will lead to decreased police involvement in our response to behavioral health crises. That's a response that we've been leaning on for a long time in Virginia. We think that this will lead to improved safety and better outcomes for folks when they are in a crisis. And we think that overall, this is moving us towards that health-centered approach, that when someone is in a behavioral health crisis, it's treated like a health emergency, and they're provided that specialized response. So I think you can go on to the next slide, and I think that's just sort of the end. That's just a quote from a recent SAMHSA toolkit on implementing crisis care that I thought you might appreciate. And I'll go on and pause there. And either if any of my colleagues at DBHDS or DCJS want to jump in and clarify anything, or we can just start taking questions.
Well, Lisa, it looks like we've got our first question in the chat box. I don't know if you can see that. I'll maybe read it out so that folks who are on the phone can hear it. So this is from Carol Lair saying, I'm having a hard time understanding what aspects of implementation of Marcus Alert legislation and mobile crisis STEP Virginia will be state, which will be regional, and which will be local. Defining that.
Yeah, that's a definitely a great question, and I can give the very broad view. We can definitely clarify from there. So really, the idea is that what's needed at a state level is this idea of the software that would coordinate regional call centers for what they call that air traffic control, and the idea of a safety net to the safety net. That if there's sort of one phone number, and if the software infrastructure is coordinated across all the call centers and that achieves statewide coverage, that really creates a safety net to the safety net. And then on the Marcus Alert side at the state level, it will be these minimum standards and best practices that we're setting for through the work group. So I don't know what the details would look like, but it could be things like certain types of 911 calls that need to be diverted, or things like that. Essentially, it'll be some framework there. Regionally, the focus is on building these mobile crisis hubs, whether they directly operate the call center or not, with the idea being that's really the best practice for regional coverage, and the idea of, you know, if one locality happens to have a lot of calls on a certain night, that it's really more about the geographic placement of the next closest team that could respond, and that's kind of the role of the hubs. Whereas then at the local level, emergency services, so when pre-screening is involved, that is already there at the local level, as well as what we call community-based crisis support. So this is essentially through the behavioral health enhancements, really those not that initial 72-hour response that'll be largely reliant on the hub, but those the follow-up stabilization services that might go, full 14 days out into the future. And then on the Marcus Alert side, it's really each law enforcement agency's specific policies about you know, essentially what they do when they are involved in a situation like this. So kind of taking the taking the state framework that we put out there and then defining what that means for their particular area. So that could be building a co-response model. That could be just making additional changes to handoff procedures and things like that, and really focusing just on having the mobile crisis response. I don't know if I'm totally answering your question, but a lot of it will still, some of those questions will get answered in the, like through the work of the work group as well.
Okay, great. Got another question from Tonya Wynn. Would you clarify again what 2 steps are to be implemented by July 1st, 2022?
Yes, that is the protocols to divert from 911. So whatever, essentially there will be some guidance that comes out from the state level or the plan by July 1st, 2021, and it'll say, you know, by July 1st, 2022, you'll need to show how you are going to, you know, for example, divert call types of these, you know, 3 or 4 types. We need to know how are you going to divert those from your public service answering point. How are you going to divert those to the mental health system? And then the second part being the serving as backup. So making sure that that you have a plan for, since we're building these mobile crisis hubs at the regional level, you know, making sure that each law enforcement agency has formed that relationship and has a plan as far as how are they going to serve as backup. You know, what's that going to look like? What are the processes and procedures? So those are the 2 that are due. Essentially, the plan will come out July 2021, and then they'll need to be implemented 12 later.
Mira.
Hello?
Yep, we can hear you.
Oh, I was going to add that I wondered if the person who was asking about, sorry, I'm trying to go back to the screen about the oh, they said 7/1/2022. There was also the December 1. Lisa, did you mention that? December 1, 2021, that was the 5 initial areas to be implemented. And then I'm just looking on my list to make sure I get the dates right. Just one second. Okay, well, I'll come back to it. I don't want to misspeak and say they're incorrect dates. But I think the bottom line is there are several dates in terms of the implementation dates. We can clarify that. Sorry, go back to you, Katie.
Absolutely, thank you. So just rolling on with questions here. I think we've gotten this question a couple times about will the presentation be emailed out? And so, sorry, with DBHDS folks, I think we'll send it out to the list that we invited. I imagine Janet will do the same at the end, so we'll circulate it. Next question is, to help us stay plugged in, will meeting notices go out via town hall? And if so, will DCJS or DBHDS be sending those meeting notices out?
It'll be DBHDS and it'll go out via town hall. And we also have, we're trying to increase opportunities for connection as well. So we'll use that as the formal method, but we also, when we took the Stakeholder nominations, we allowed for folks to just put their email address if they'd like to stay connected. So we will also sort of have an email listing that goes out as far as you know, just trying to spread the word, particularly for those 3 public comment ones. All the open meetings will be recorded.
Great, thanks. So we've got a question coming in. How will the participants in the Marcus Alert stakeholders group be selected?
That's a good question, especially with the overwhelming interest that we got. So we're looking at this between DBHDS, both on the behavioral health, mental health, substance abuse, and developmental disability side, as well as our CIT coordination. And then with the external partners, we have Department of Criminal Justice Services. So Harvey, while he's before we bring more staff members online, and then with the advocacy committee as well. With our one thing we have been saying is, so we through the nomination process, people could receive multiple nominations, but we've also been getting, some outreach, and so feel free to tell us, during this call, if there's something that you're concerned about. For example, we want to make sure that the magistrates are involved. If you have any feedback like that, feel free to share it with us here, or to send via email while we're trying to get the composition. I will also mention that each initial area will also be forming a group, even though the state group is 20. There will be these five area groups will be coming online, just about 2 months down the line as well.
All right. So next we've gotten a question about funding. Is this an unfunded mandate? Will the General Assembly be providing budgetary assistance to local CSBs and law enforcement agencies? And maybe you could speak to the sort of initial round of funding that the General Assembly put forward in the special session, and then maybe what's expected to kind of continue to carry this out, the sustained investment that will be needed.
Yeah, sure. So we can, in terms of the funding that was added specifically, there is $3 million for teams and the Marcus alerts that was added in fiscal year 21 and 22 to the grants to localities budget item funding source. So that was added in conjunction with the legislation. There were also several items related to the Step Virginia planned implementation that had been unallotted during the kind of uncertain economic times related to the onset of the pandemic, that were then reallotted during the course of special session. And those relate specifically to mobile crisis teams and dispatch, local dispatch teams. So those are under Step Virginia, and those are reallotted. So that's call center staff and the amount of 4.7 million, and mobile crisis teams and the amount of 6.1 million. Additionally, as was previously stated, there is a full-time staff member who was allocated to DBHDS as well as to DCJS to assist with the coordination, implementation, analysis, and many of the other aspects of implementing the Marcus Alert Act. In terms of the ongoing sustainability, I guess we would point to a number of aspects. Number one, the General Assembly has sort of signaled its long-term intent to support Step Virginia, which is a long-term initiative to improve and support the consistency, access, and overall service availability of community services boards, and that includes mobile crisis services. So that would be, certainly be a key piece of continuing funding and resources related to the long-term development of the comprehensive crisis system, as well as through efforts related to what's being called behavioral health enhancement, which is an initiative through the Department of Medical Assistance Services, or DMAS, as well as DBHDS and numerous stakeholders, which in a nutshell is to increase Medicaid reimbursement rates for a number of services, including comprehensive crisis services. But obviously we will be very eager to see, in terms of long-term funding and sustainability, exactly what this looks like in the future. But in terms of the specifics of, this past special session and FY21 and 22, there were dedicated and ongoing pots of funds that were allocated for the implementation of this effort, as well as the broader comprehensive system, comprehensive crisis system, rather.
All right, thank you. I'll just keep on trucking here so we can try to fit in as many questions as we can. Kind of a comment, I think, from Mr. John Jones with the sheriffs about participation from law enforcement. He points out that the proposal sort of talks about one person representing leadership, and notes that there's sheriffs and chiefs of police, and points out that you should consider increasing leadership from law enforcement to represent both sheriffs and chiefs. So I convey that.
Yeah, Harvey had been on that same wavelength when we were talking. That representation would make sense. Thank you.
Yeah, and let me just weigh in on that briefly, Mr. Jones. We're making sure that the panel will represent leadership and boots on the ground, CIT experience, and from a variety of different perspectives in law enforcement, whether they're rural counties or urban cities or somewhere in between. And we want to make sure we get as many of those things represented as possible on this panel, while still managing the size to be a workable group. So that is an important thing, that we have a lot of different perspectives in on this, especially from the law enforcement angle, because law enforcement in the Commonwealth of Virginia looks very different one jurisdiction to the next. There are some jurisdictions that face very different challenges than others. And so we have to have all of those folks at the table to make this thing work. So that's a very good point, and we are committed to making sure that happens.
Thank you very much. I appreciate it. And that was my concern. We've got law enforcement agencies from one end of the state to the other, and some of them are different than others. So we just need to have a representative of all the different sizes, urban, rural, at the table. And Harvey, I appreciate your comment. Thank you.
All right. Next question is an invitation to come and speak at the Virginia Association of Local Human Services Officials Legislative Conference. I imagine they could follow up with you afterwards. The details on that.
Yep.
Let's see. Let's see. And then I've gotten a question kind of generally about regional coverage and how it's sort of envisioned that neighboring jurisdictions would respond. And I think the gist of the question is sort of, when something might be urgent, how would that be envisioned to be working out?
Yeah, that is definitely, I don't have an answer for you, but that's definitely, really a part of the key complexity that that we'll be talking about here. I'm not sure I'm not sure if your area has done the crisis intercept mapping, but sometimes that exercise can start to help it work. And some of this will also have to do with the technology behind the crisis call center. And it looks different in different states. One example I'll just throw out because it's vivid is some states it's almost like an Uber app where the closest team responds. It's technological pieces like that. So that's it's just a huge key piece of it, and something that we're going to need a lot of stakeholder input on. Heather, do you want to add anything to that? So Heather's our lead on the comprehensive crisis system, and specifically the call center and the hub. So follow up on that, Heather.
No, I think I'm good in terms of what you said. I think we're working through all of that, particularly when regions overlap with one another. It's one thing when it's close proximity and it's within the same region. It's another thing when it's close proximity and it's in a neighboring region where those lines cross. So we'll have to work through all of that as part of the work that we're doing with comprehensive crisis, and then also with the Marcus alert, just to see how we can streamline all of that as part of this process.
Okay, I'm just, thank you all. I'm just giving it a second to see if any other questions pop into the chat. Well, I think seeing none, we're getting
Let me
close.
if I can jump in real quick, let me add one quick thing. I've had a couple of private questions regarding next steps for law enforcement specific. DCJS will be hiring a full-time position to take the lead on this and making sure that all law enforcement across the state have enough resources to move forward on developing policies and procedures and reviewing things going forward. So just as a point of issue, as we get into the new year, you should look for in the first couple of months some virtual opportunities more geared specifically towards law enforcement, where DBHDS and DCJS will jointly go through some more specific stuff that more directly relates to law enforcement. This was meant as more of a general first step in that journey. So just as those of you from a law enforcement perspective that may be looking for more solid stuff, we'll be looking at that in the next few weeks. Thank you for that interest, though.
All right. Well, I want to thank our presenters very, very much for taking the time to brief our members. You can tell there's extensive interest out there, just judging from the participation that we're able to get kind of in the beginning of a holiday week and on short notice. So really look forward to continuing to stay in communication with you all as we work through implementing this legislation. So thank you all very, very much, and wishing everyone a happy holiday and a good rest of your week. Thanks so much.